All right, let's talk about the adrenal glands for a little bit. And for the endocrine system on the NCLEX, you really just need to know, or really just need to focus on two things. One is on the adrenal gland, and the other is on the thyroid gland. Okay, so I have a whole thyroid lecture. Make sure you listen to that one, but this one's on the endocrine system. Adrenal cortex diseases start with the letters A, and they start with C. Okay, so you have Addison's and you have Cushing's. All right, so the adrenal cortex, Addison's, Cushing's. All right, adrenal cortex. So underline those letters on there. The A in adrenal and the C under cortex. Start with the letters A and C. All right, so Addison's disease. Addison's is an undersecretion of the adrenal cortex. Okay, and what does the adrenal cortex secrete? Well, it secretes steroids. It secretes your glucocorticoids and your mineralocorticoids. So for patients who have Addison's, they're undersecreting their steroids. So what are we going to do? Are we going to take away something or are we going to add something? Well, they're already deficient, so we're going to add a steroid. Right? And what do all steroids end in? There's 15 or 20 of these. Drugs like prednisone, cortisone, dexamethasone. So what do all these end in? All right, they all end in sone. So we are going to add a sone, S-O-N-E. So for Addison's, you add a sone. For Addison's, you add a sone. And that's, again, because we have an undersecretion of steroids from the adrenal cortex. Now, signs and symptoms of Addison's. There's really only two things you need to focus on. Number one is that they tend to have hyperpigmented skin, so they're tan. Okay, and the second thing is that they don't adapt to stress very well. Okay, so any kind of stressful situation, these patients, have a pretty high likelihood of coding on you because they're not very adaptive to stress. And being sick, being in the hospital, and other illnesses are going to add stress to your patient who has Addison's. So you want to keep a close eye on them. Now, for treatments, you basically just give them steroids, right? Mineralo and glucocorticoids. So like we talked about these, prednisone, dexamethasone, they're all ending in sone, S-O-N-E. So that's really what you need to know for Addison's, okay? Now, Cushing syndrome. Right? You got this goofy-looking sketch on your sheet here, and this is a study strategy and memorization strategy that will help you tremendously on the NCLEX, and whenever you're thinking about anything that has to do with Cushing syndrome. Okay, now Cushing syndrome is an oversecretion of the adrenal cortex. It's the opposite of Addison's. Addison's, you don't have enough steroids, and in Cushing's, you have too much steroids. There are two different ways that this can develop in your client. One is from a malfunction in the pituitary gland that releases too much ACTH and then causes the adrenal glands to create too much steroid. The second is by giving your patient steroids, you can cause Cushing syndrome. Okay, so the treatment options are an adrenalectomy. And your client might have a bilateral adrenalectomy or a unilateral adrenalectomy. Okay, so for a bilateral adrenalectomy, they have no adrenal glands, right? Because you take it out bilaterally, both sides. And for that, they're not going to be creating any steroids. So what are you going to have to do for this client? Well, they're going to be given steroids. They're going to be given steroid replacement. Now, if it's a unilateral adrenalectomy, you probably won't have to give any steroids. But these patients are going to have reduced immune function, so you're going to want to make sure that you scrub your hands. These patients are going to want to be in individual rooms, okay, so to help fight the risk of infection. Now, what are the signs and symptoms of Cushing syndrome? Okay, so you have the outline of this funky-looking character on your sheet here, and I want you to draw along as I talk to you about this, and I want you to label these things. And our character here, his name is Mr. Moon, okay? Mr. Moon has a moon face, all right? So they get that rounded appearing face, looks like a moon, okay? So you want you to label that, moon face. Now, on the jaw of Mr. Moon, I want you to draw some whiskers. I want you to draw a beard on him, okay? Because Mr. Moon has hirsutism, right? That's the growth of facial hair. Right? So you are also going to draw a little bubble, like a cartoon bubble coming out of his mouth that would include words like you see in a cartoon. So he's going to be saying, I am mad and I have an infection. Okay. Patients on steroid replacement therapy, they get grumpy and they're at high risk of infections. So again, I want you to draw a cartoon bubble coming out of his mouth saying, I'm mad and I have an infection. Right. You'll see that Mr. Moon, has a big bump on his chest, and that's his gynecomastia, right? Which on a male is basically the growth of what looks like breast tissue. Right. Across the top of the chest of this Mr. Moon, I want you to draw some waves, okay? Like the top of the ocean, and it's going to go right across his like upper chest, shoulder area, because he's retaining fluids. So these people, they blow up. They got a lot of fluids on them. And on his back, he's got that bump. So I want you to label that the buffalo hump. These patients have a fat deposit, a fatty deposit that starts to grow on the top of their back, giving them that buffalo hump-like appearance. So the bump on the front is gynecomastia, and the bump on the back is the buffalo hump. On his back there, I also want you to draw some bruises, because they bruise easily. These steroids affect the capillaries, so they bruise easily. Across the belly, across the lower part of that bulge, I want you to draw some wavy lines called striae. These are stretch marks. And on the back of the lower portion, Mr. Moon has a pear shape. So I want you to label that pear shape. On that lower abdomen section, I also want you to draw an arrow facing up, right in the middle of that lower abdomen area, and just write glucose next to it. So they have increased glucose. Coming out the back of the client, I want you to draw a couple little circles with a K plus inside them, because that is potassium being excreted. So these patients lose potassium. I want you to label those thin extremities, arms and legs, thin extremities. And they're jiggly like that because they're weak. They have osteoporosis. All right. Now, what I want you to do is take another sheet of paper at some point, lay it over top of this guy, and trace him out, okay? Or flip the sheet over and draw him from memory. Mr. Moon, right? So once you've drawn him 3 or 4 times and labeled him, you'll be able to visualize this anytime that you have any question on the NCLEX or as a nurse about the adrenal glands, about Cushing syndrome, and what are the side effects? So when I'm administering my patient this steroid, what kind of stuff might I be teaching them? All right, I might be teaching them, say, hey, don't be too surprised if you start to experience certain side effects. Some patients experience all of these. Some clients experience none of them. So don't be surprised if you start to see some of these things. So we're going to want to teach them certain stuff about, how would their osteoporosis affect their life? How would retaining fluids affect them? What are we going to teach them about the bruising? What are we going to teach them about monitoring their blood sugar and what that's going to affect? What are we going to teach them about infection risk? What are we going to teach them about their relationship with their spouse and their changing mood? All right, so these are all things that might be tested on the NCLEX. You could see how you could ask a ton of different questions about this, whether it's from a teaching standpoint. What lab value should we most monitor? So we're going to monitor their potassium, and we're going to monitor their glucose. Right? So this is an area that could be highly tested on the NCLEX or any exam, because there are so many different things that Cushing syndrome affects. So, endocrine overview for adrenal glands. The adrenal cortex diseases start with the letters A and C, Addison's and Cushing's. That's the 2 adrenal cortex diseases that you need to know about. Addison's. For Addison's, you add a zone. For Addison's, you add a zone, right? The zones are steroids: prednisone, cortisone, dexamethasone, right? And it's related to an undersecretion of the adrenal cortex. That's why we're giving them steroids. Signs and symptoms are the hyperpigmented skin, so they're tan, and they don't adapt to stress well, okay? The treatment options are to give them steroids, right? Now, for Cushing syndrome, that's an oversecretion of the adrenal cortex, or it comes from long-term steroid therapy. So the treatment options, if it's something that the body has created, you can do an adrenalectomy. You can take out one of the adrenal glands, and so they probably won't have to have steroid replacement, but they will have a weakened immune system. Or they might do a bilateral adrenalectomy where they will have to have steroid replacement. So, signs and symptoms. Remember, Mr. Moon. Mr. Moon has a moon face. He has hirsutism, which is that beard growing. He's telling you that he's mad, he is cranky, and that he has an infection. Okay, he's retaining fluids. He has gynecomastia in his upper front, and he has a buffalo hump in the back. He's got bruises all over from his fragile capillaries, and on his belly, his rounded belly, he has stretch marks. He has striae. And he has a pear shape to him, right? Mr. Moon also has an increase in glucose and a decrease in potassium. He has thin extremities and is at risk for osteoporosis. Right? So that's just a quick overview and summary of the adrenal glands. And I mentioned in some of the other lectures, what I want you to do when you're studying for this is to imagine that you are the instructor. What kind of questions would you write to assess your students' knowledge about the adrenal glands? And remember that as nurses, it's our job to look for side effects, and it's our job to teach our clients. Okay, so focus on teaching and side effects for a lot of the stuff that you're studying for the NCLEX. You'll learn a lot of other kind of secondary and tertiary information when you're focusing on side effects and patient teaching. And that's really a great way to approach any subject that you're studying for on the NCLEX. All right, so there we go. Adrenal glands, Addison's, and Cushing's. That's what you need to know.